think anything we can do to help our neighbours and partners and generations 3 times down, I think we should do.
This is a way that prevention is better than cure. And if it can prevent anything, it's only beneficial.
We will hopefully be, as possible as it can be, disease-free.
And then I think medically, the tailoring might mean less invasive treatments.
Generally were in favour of sharing information, and they saw the benefits of pooling information across the population.
I think the benefits of genome advancement far outweigh the risks, and there obviously are risks. There are always risks in everything.
I think the whole process from start to finish, the way you've spoke about it, the DNA, how they're going to pass it on to the rest of the world, not even just England, I'm just amazed. I think it's fantastic.
I think as a researcher, I definitely see the benefit of trying to make sense of the rest of the genome by borrowing information from more people.
Up until now, there's been a very clear line. There is, you go to the NHS and you get treated, and that health data is there. And you join in a health study, clinical trial or what have you give consent, and that's there.
Information for research purposes, I think you kind of give that freely and willingly, and you probably don't really get anything back. I think clinically, if you were to give that, you give that, and then what you're expecting back is some form of information and support.
I think people do have an obligation, I don't think it should be forced, but I think they do have an obligation for the greater good, if you like, for the benefit of the nation.
So I think this potentially will kind of need a very different approach when it comes from a doctor's perspective or healthcare and physicians about how they need to interact with patients as well.
A deeper relationship with the medical profession, with the medical community, so we'd hope that the actual nature of the health system and the scientific community will be closer.
Work between the public and the private sectors, because the amount of money that's involved and the amount of work that's necessary to take this forward, we're talking, millions, and you can't expect the NHS to find that money just at the drop of a hat, because they're struggling, with their finances, as we all are aware. So, but people tend to paint the drug companies as some kind of evil power, whereas without the drug companies there wouldn't be the research and the production of the medication that's necessary for people to get potential cures or treatment for conditions.
I think it's the role of the NHS then to encourage people and make them realise that it is a benefit for them.
The public are not going to be the first people to understand what is going on. But that's the job of scientists, of researchers, of the NHS, to communicate this.
Basically, the role of the NHS is to deliver the results of the research at the coalface, basically delivering the research and its applications to patients.
Very clear expectations and guidance in regards to how what it looks like in real time when it's working. How what will the data be used for? How will it be stored? Who are you going to share it with? What protocols are in place to when you share it?
They need to have the right supports in place. So I think the genetic counsellors that they mentioned, they need to make sure that they have enough.
You need counsellors, genomic counsellors, who they take time to train and to reach a standard that would be proficient enough to deal with it in the volume and the numbers.
I would need assurance that it will be kept in that place where I can feel that duty of care as a patient and as a human being.
If my data was numerized rather than a name on it, and that would help, if it could possibly help with research in the future, I'm quite happy for them to have that data. I think they need to know that that there's nothing to be scared of by getting involved in giving your data, that it hopefully is all for the good of everybody, that they can do this research.
Because knowledge is power, and the more knowledge we have, and the better we can make the NHS more efficient, potentially by having direct ideas of exactly where to go to treat people, or what needs treatment and what can be treated.
I think it's imperative that we have the dialogue. I think primarily it's going to be useful for patients. It will help us define how those services are developed and delivered to patients.
It's so interesting when you get talking to people about what this world can open for us, and especially worldwide, not just the UK.
I think it's really important to involve the public in decisions that concern them, and that's particularly important so that policymakers can be informed and set policies that reflect public opinion.
I feel quite privileged that I have been chosen, and it has been really, really interesting, I will say that. And just getting all the different views, negatives, positives, everything else has been really, really good.
I'm very inquisitive and I love to ask questions and I love to learn, so it's been all good for me.
It's a very useful way of actually understanding how much work still needs to go on in order to impact some level of change when it comes to people in the public in general.
Public dialogues are the best way forward. These forums and these workshops is ideal because everybody gets to hear what everybody thinks.